Okay. So likely cause of the acute kidney injury. Okay. So 35-year-old woman with a 1 week history of fever, rash, and onset joint pain. She's been taking ibuprofen for the pain, hypertension. She takes lisinopril, macular papular rash, elevated BUN and creatinine, mild proteinuria, and eosinophiliuria. Okay. So, 1 week history. So she takes too much ibuprofen that also could damage the kidney. So depending on how much ibuprofen she's taking, AIN could definitely be an option.
Okay.
She's not diabetic, so I don't think it's gonna be diabetic nephropathy. Glomerular nephritis is not that's like a really broad term considering she has proteinuria. Nephrotic syndrome would be more likely, so I would probably get rid of glomerular nephritis. And she has hypertension. She's on lisinopril. It doesn't say how controlled it is or not, but I don't think it's renal vascular hypertension. I'm probably leaning more towards acute interstitial nephritis because it's acute and she's taking ibuprofen on her own, so she's probably taking too much of it, would be my
Okay.
bet.
Yeah, this is gonna be the best answer, right? Nephrotic syndrome, right? There's a cutoff for nephrotic syndrome, right? I can't remember. I think it's 3 grams over 24 hours. I could be wrong. It could be 3.5 or something like
I think
that.
it's
Just
3.4, but yeah.
is it 3.4? Okay, perfect.
That number sounds familiar, but yeah.
Okay, gotcha. There's ways, to quantify it, but mild proteinuria, right? That's not nephrotic syndrome. You got to be leaking out a bunch of
Mhm.
protein, right? But one of the key things that's more specific for AIN, right, is the eosinophiliuria, right? There's not many diseases where you pee out eosinophils. Right,
Okay.
it's so specific for acute interstitial nephritis, but also on top of that, right, they tell you the ibuprofen, right? So, also like lisinopril, some diuretics can cause it too. So you have kind of two hits there, and then you have kind of your eosinophilia urea. So